Welcome to the Maryland Healthcare Commission's Healthcare AI Symposium. This presentation is part of a virtual symposium on the equitable, ethical, and responsible use of artificial intelligence in healthcare. The symposium features a range of presentations on AI risk management, from cybersecurity to AI-specific issues, including algorithmic bias, data integrity, and transparency. Visit the Maryland Healthcare Commission's website for more information. You can find a link to the Healthcare AI Symposium's webpage featuring all of the presentations in the description box below this video.
Hi and welcome. I'm Mac Benra with the Maryland Healthcare Commission. I would like to introduce our next presenter, Arun Pamalapati. Arun is a senior security field engineer at Databricks with 25 years of experience building data products, including over a decade of experience building AI products. Arun led and co-created the Security Analysis Tool, a software-as-a-service security posture management for Databricks. He is also co-author of the Databricks AI Security Framework. Arun holds various industry certifications and contributes to High Trust and Fair Institute AI work groups. Arun, thanks for being part of this Healthcare AI Symposium. I'll now hand it over to you.
Thank you, Mac. So I'll be covering a program that we've been working on for over 2 years now, which is how customers and users of AI, which is coming in a fast and furious nowadays, both for in the public sector as well as in enterprises. And there are a lot of questions around AI risks. So by doing a lot of workshops in the field, both in public sector as well as in the private sector, we came up with this a pragmatic approach for demystifying AI security risks. And I'm here to present that to at this conference for you all to take in, understand the basics of what AI looks like, and then how you can actually implement mitigation controls for these AI risks. So with that, let's look into what makes AI AI. So to understand that, it is easier if we compare and contrast to what we all been using in computers to make some decisions, right? So if we start with traditional computer programs at the top, it has been the process of basically automating, taking some inputs and making some decisions and producing a type of report or a decision that can be used by the downstream systems. So let me rephrase this. So if we have a program in a given organization, that is the purpose of that maybe is to detect fraud in medical charges. Like there is a provider who provides services, and then they go and bill it with insurance companies by to reimburse for that service that they provided. So if we take that as an example, the systems that are out there to process this the charges that are that are sent for reimbursement, the systems would look for, hey, is there any kind of fraudulent upcharges, right? So for such a program, you would be coding using traditional, any of the well-known programming languages. You will be using those, and then you will be applying what this service is about. Say, let's take simple example of a fractured bone, and then you may have certain codes for that, and you look at the code that they used for basically for this reimbursement, and then you would try to make a decision based on that if this code is appropriate for this service, and then if there's an upcharge, if there are if there is some kind of situation where the patient was diabetic, and in those scenarios, they may be able to use different code, and you apply certain rules, and then you make a decision, right? So that's how your traditional programs work. It is good for what it is being built for so far, but we can do better, right? So with AI models, it takes into consideration much bigger data set than this one, specific, reimbursement, file that came to the system, right? It will look into overall all the systems that were all the submissions that were done by this particular provider. What has been the pattern in the past by them, right? Like, there may be, compared to that region, there may be more upcharges by this provider. Has there been a pattern of this specific provider doing these kind of upcharges? So AI system will be able to model around that and detect fraud much more effectively if it has scenario based, looking at traditional what upcharges look like, and then it would be able to make a conclusion and predict that this specific bill may be fraudulent or may not be fraudulent, right? So in these scenarios, the AI models take into lots of data, and then data by itself is kind of labeled, like what kind of submissions would look like fraudulent, which kind of submissions are not fraudulent. So based on the historical data, AI would be able to build a model and takes into consideration of human instructions, and then put some probability into, hey, I feel that this may be probably a fraudulent submission of this specific bill that was submitted by this provider, right? So there is always a bit of bias into these models, so that's something to be taken into consideration based on the historical data, what was labeled by humans, and it may be, there may be some kind of judgment call that is done by models. Bugs are not new in any computer model, but bugs are predictable, and you can actually reproduce them and fix them. Biases are harder to detect, right? And if you take AI model that is trained on historical data, the data itself can be poisoned, or the data itself may have some kind of risks involved for that is being used by these models that is actually producing these predictions, right? So given the potential of AI, which is actually can be used for detecting these this kind of example that I gave, where it can look at a large amount of data and then reduce the workload on humans who are actually trying to process these bills, improve the processing of these specific bills that are going through, but at the same time producing a good amount of indications around fraud, and being able to reduce the fraud. There is a lot of potential there, but at the same time, we need to take into consideration, can this AI be tricked by how you ask the question? Can this AI be tricked by poisoning the data? Can this AI be subverted by hackers and then bring the downstream systems to halt, right? So those are the things that we need to take into consideration. So let's look into some of the examples that can that are out there out there in the world, where some of the concerns are some of the issues that are that we should be thinking about. So automation and AI is great. It is going to reduce the workload on humans. For example, in a autonomous car, you have definitely lot of assistance that you're going to get as a driver, but sometimes they also may fail and then get into in this scenario, in this example, where it may be even fatal to the human who is in the car. So AI is not traditional computer where the decisions are made based on the rules that you have written. AI is based on the understanding and the learning the models have, and then making a prediction. And prediction in this case is not a bug. prediction is a feature, right? That's how AI is able to see if there is a cone or if there is a person in front of it, and it is making predictions continuously. But prediction by definition itself is that it can be wrong, right? So we need to be we need to be conscious to the fact that we shouldn't be overestimating that AI is going to get always everything right, right? Just because it is a computer, just because it is tested, sometimes it can it may be getting it wrong, and then we need to have guardrails around it. We should be able to take the control of it. We should be able to have the necessary security controls around the system, right? So let's look at some of the examples, what the security risks for the look like, and then we'll go into how we should be able to thinking about mitigating those security risks, right? So I'm going to walk through a few examples, and then I'm going to ask you a question, whether this is a traditional computer, traditional cybersecurity risk, or if it is a novel AI risk, right? So let's look at the first example. In this example, it's a large enterprise, Fortune 500 company, where they trained a model. The intention of this person who trained this model is to make this model open source. So they have good intentions of making this widely available to other people who may be solving the same problem, will be able to take advantage of this model. So they want to publish this publicly. But unfortunately, in that process, they made a mistake, and they actually checked in that entire code base with the credentials, which has access to 38 terabytes of data, right? So if this model gets into hands of bad actor, they can use those credentials and then get access to the entire data set, right? Is this error, or is this exposure anything to do with AI? Insufficient access controls is what happened here. So something to think about, and then when we get into mitigating these, we need to kind of see whether we already know how to put controls around it, and which ones the novel ones that we should be thinking about, what new controls we should be bringing into action, right? So in this situation, even though it has to do with AI model, this specific one is traditional cybersecurity control that anybody and any organization should be thinking about as you put your credentials out there, or as you put your code base out there into public. You should be making sure you're cleaning it up for any type of tokens or some kind of credentials that are in there before kind of you make this public, right? So, but let's take another example. In this example, AI model at the top on the left side is looking at predicting what animal is inside of that picture. So ideally, as this model is trained on lots of images, it should be predicting this as a panda, right? When you present it to panda. But in this research, they were able to add some noise into that picture. For a human naked eye, it looks like panda because the noise is not visible. But for the AI image processing system, it looks like a gibbon. So why, Arun, you're talking about, healthcare AI models. Why is this important? Which animal it is, right? So take an example where you are taking, you are basically looking at some, X-rays of, fractured bones, or are looking at any kind of cancer in these X-rays, and then if the model that is predicting is whether there is a tumor or not, whether it is benign or malignant, whatever the prediction is in those scenarios, if some bad actor introduces some kind of noise into those images, for a person who is actually looking at those images and as a process, those images may look accurately for them. There is a cancerous cell or there is no cancerous cell. But for the machine, that model that is actually looking at them may get confused, right? So models can be evaded. There can be evasion attack, and then that can be really dangerous for outcomes that model is bringing out, right? Just by adding some simple noise. And you can see another example here. This AI model that is autonomous model is trained on lots and lots of examples on the road signs and road rules, which is a good thing. But it can be tricked. Now, in this example, this car will not get out because it thinks this specific line. It is looking at a line, and it is no cross line. So models can be tricked by either through by giving a situation to the model where it doesn't know what to do, or by adding some noise, it can actually get into trouble and not predict accurately. Or models can also be Trojan models where they are planted in an open source environment like Hugging Face or whatnot with malicious intent. So there can be an open source model that it can be introduced, and then somebody who has same business problems trying to solve that, instead of doing their own training, they may get that model from that place, and then thinking that they're actually using that model for their own applications, they put there in their own enterprise environment, but this model may be calling home and then exfiltrating PHI data back to the actual model maker. It is basically in a typical command and control attack scenario, right? So we need to keep in mind, and there can be examples where a model can trick or somebody can trick the model, and then model may not have the context of the environment it is in, and then in this case, it is basically this model is recommending a competitor's car to somebody who is asking the question, like which car should I buy, and it is saying like this specific car is better than our car, which is like it's lacking the enterprise context. It doesn't it's kind of going without guardrails. And it can also make some legal situations harder for organizations to navigate if it goes and makes commitments to somebody who is interacting with it, and then provides incorrect or false promises, and where now the organization may be in a situation where they have to keep that promise because that is this model is making, right? So these are some examples. So to summarize, why we should care about AI security, right? We should be thinking about, when we talk about risks to AI, they can come in three different flavors, and all of them encompass as security risks to AI. Some can be in your traditional cybersecurity risks. Some can be adversarial machine learning, where we had seen with examples of Panda and Gibbon example. And it can be responsible AI, where you don't have guardrails. So if you are thinking about AI security, we need to think about all-encompassing scenarios that go into your enterprise application, especially when we are talking about healthcare AI and health-related scenarios that we are trying to address, where there is a lot of PHI, PII information involved, and the decisions that are made by health applications can be very, very impactful to patients and systems that are serving those patients. So how do we go about? Yeah.
You've made a great point about these differences between traditional cybersecurity and AI security. When we think about cyber attacks and how the healthcare sector is highly targeted, what should healthcare organizations be doing today to manage risks specific to AI as it relates to current vendors and potentially new vendors? And how should healthcare organizations rethink security assessments?
That's a great question. So to get started with, first of all, organizations need to start understanding that AI is different compared to the traditional software, right? And to do that, I put a quote out there. I'm not going to read this, but to do that, we need to start learning the new things and start unlearning what worked in the past may not work now, because the way the systems work, the way the risks that are around these AI systems is very different to handle from the traditional system. So we'll go into the details to answer your question, which is basically, one of the things that's happening is that it's proven that AI is very powerful. It can be one of the most important tool in your toolbox of automation, and improving patient care, or to overall improve the healthcare system itself. There is no question about that. And AI, the good news with AI is that it never stops learning, so it doesn't get tired. It learns from its mistakes based on feedback it receives as it is operating in this world. But we, as the practitioners, need to kind of take advantage of this shift that is going to come and help improve human quality and human life, right? So to do that, organizations already, I don't need to give you these numbers and make hype up AI anymore than what it is already. Organizations are definitely working on that, but they're running into the challenge, as Mac, you asked the question, what are the challenges? How should they be making this more into production? Why are they not going into production, and why are they not using these systems out there? The biggest concern is security risks. They need to get approvals from their own internal cybersecurity teams, and they need to be able to make sure the guardrails that are necessary for these AI systems are as robust, if not more, compared to their traditional systems, right? So, and organizations want to do this. Organizations want to adopt AI because they know the potential of AI, they know the value of AI, and they want to do this by minimizing the risk, though. They don't want to just put it out there and hope that it's all going to work out okay, right? So, Mac, to answer your question, first, they need to understand why AI is hard to manage, as far as risks are concerned. So if you talk to CISOs, the chief information security officers, and if you talk to the security and risk people and compliance people, privacy people, the first thing is they don't know how to think of AI as a mental model, right? If you talk about your traditional software, there are so much understanding and literature out there. Say there is NTR architecture, or there is if I'm putting something in public facing, this is in my DMZ, here is my network controls, here is my WAF. They understand those. In AI, they don't understand, they don't know necessarily know all the components that are involved. What makes AI, right? They don't know whom to work with. They don't know, they're not sure about the people roles and who should I be going for certain approvals, who is data scientist, who is compliance officer, who is governance officer. If something goes wrong, which team I should be working with as a security organization, right? So in case of web applications, in case of traditional, analytics platforms, they know these personas. But in the new AI world, they don't know who these people are and how to communicate with them, what language to use with them, right? And they're missing comprehensive AI risk catalog. They don't know what risks are there in AI at all. They read something about in a blog or in a news, but they don't know what is the comprehensive set of risks involved, right? And they're unaware of risk implications from different deployments of AI. What I mean by that is, if I'm using, say, ChatGPT in my company, what are the risks that I should be concerned about? If I trained my own ML model, what risks should I be concerned about, right? There is a huge difference between these two. And if I'm using a open source model that is out there, if I bring that into my organization, what risks should I be concerned about, right? So, and unclear about how these AI threats are going to impact their applications underneath these, because they got these into the organization. How do I contextualize which risks are going to be applicable based on how I'm using AI? And then what control should I be putting at the end of the day? The reason they don't have this is, for these novel risks that are involved with AI, they don't have instinct to, okay, if this is X, I have to do Y. There is not enough of practice. There are not enough reps that went through when deploying AI systems, right? So this is what, yeah.
A quick question for you. So thinking about those unique challenges with managing AI risk and some of the differences between AI security and traditional cybersecurity, What should healthcare organizations be doing to manage these risks as it relates to working with vendors and potentially new vendors?
Excellent question, Mac. So to get started with, first, they need to build a mental model of, how AI components look like. And then when you're working with these vendors, what is that you are actually taking from, getting from these vendors, right? Are you getting a model? Are you getting a platform? Are you getting, a pipeline, ingestion pipeline of data? How are they deploying? Where are they deploying these? Is it in your own enterprise? Is it is it as a SaaS platform at the vendor, in the vendor's network, right? So to do that, first they need to understand and be able to define and have a mental model of AI components. They need to know which people in the organization they should be working with, and then they would need to kind of enumerate what are the risk sets. And as they bring in these new software pieces into their organization, what risks that does it come with? And then how are they deploying these AI into their organization? Like, which deployment model are you using? And then be able to map these risks to the threats that may happen in their enterprise. And then being able to contextualize based on the use cases that they are building on top of this AI, which threats they should be, be concerned about, and what controls that, does this platform has in place, so that you can operate your AI with minimizing those risks that we talked about, right? So that way you have now instinct to, way of approaching and be able to deploy those and make sure that those are operating within your enterprise with those risks minimized, and then applications are functioning as you expect them to function, right? So, Mac, to answer your question, let's first start with what AI looks like. If you take a very high level approach, right? Very at a 30,000 foot level, what AI consists of is a process of collecting the data and having that data ready for going into your AI application, right? So in the example of fraud detection that we talked about, it is all of your patient data, all of the billing codes that go into what, how they should be looking like, past payments, whether if any of those found to be fraudulent. That is all your data, right? And then the model gets built on, like in the past experience where somebody said, hey, this particular claim is fraudulent, so they labeled it. So now you can train a model saying that, hey, if a specific claim has this type of pattern that we think is a fraudulent one. So the model is going to be trained on past historical data, or you can bring a model from outside. You can bring a model from something like Hugging Face, or you can use a generative AI model if you are trying to scrape through some of the claim forms, right? So, and then you're going to put these things together and build an application, which we call model serving and monitoring of those models, right? This is a very high level picture, but and then you need to have some governance around that model, the deployment, and you need to have a platform that is robust enough, that has all the things that you expect, like vulnerability detections and patching and all of that that goes around any type of software application, right? It's a very high level how an AI system looks like, but the important piece is understanding the individual components of these models, right? So what happens at the left when we talk about AI is the most important piece in any industry, but especially in the health industry, is that the data, right? On the left side, you have this data that can be PHI, PI, very sensitive data when it comes to health applications. So in the middle is basically building these models, right? So the process of whether you get a model from external, systems, like ChatGPT or like any type of that model that is there, like Epic and so on and so forth, or you may train your own model. And then the next piece is serving on the right side, and at the bottom, basically the operations that go in around that, like DevSecOps and all of that. And the platform itself, is that platform robust, right? So when you ask me a question like, what the organization should be thinking about when they're getting these, AI systems into their organization, is to have a picture of what is that we are getting. Like, are we getting data from somebody on the left side? Like, sometimes you may need to get claims data, or you may need to get some codes data, right? And is that data clean? And did we secure that clear data on the left side? Or if they're giving you a model, is that model hosted in a secure way, so that it doesn't have exposure that would be tricked by some hacker to exfiltrate all the data from your system? Or on the right side, when you are hosting a model, is that model serving endpoints that we call? Are those endpoints secure? Like, can my applications connect to these model endpoints in a secure way with proper authentication and authorization, so that these models are serving only to the applications and people who have authentication or authorization to access them, and not to anyone else. Like, do I have IP allow list? Do I have private link connectivity? Do I have single sign-on around these applications? And do you have multi-factor authentication coming into this platform, right? So let's build this out. On the left side, as I mentioned, you have this data that is, that needs to be taken care of all the time. This is not new for most organizations. They've been, collecting the data. They've been prepping the data. They have these data sets, and they catalog with labeling, attribute-based access controls, classification of the data. That was there. And we need to enforce that these continue to be there in AI system also, because in the business intelligence applications, the left side was very well orchestrated in the past. The middle ones are, now the models are going to get access to this data, and then we are going to serve those models for the applications to build on. And then if you double click and go into the details of that, this is how a picture of AI looks like, right? So this is first, building a mental model about how an AI system looks like, and comprehensively thinking about protecting the AI system, not just the model that most of the time people tend to talk about, is my model secure, or not just the endpoints, but have we taken care of all the things that are needed to protect the data? Do I have right authentication, authorization policies on my data set? Who has access, and who is governing, who is approving this data, available to go into these models or to these agentic systems? Does the agent has right permissions on right data set? Can it be tricked by a malicious user to get some data that it shouldn't be exposing to? So you should be treating AI agents as people and having service policies and around those agents, so that as the agents are accessing the data, they're accessing the right columns and right rows of the data, not everything that goes in the catalog, right? And are we monitoring who accessed what when? Just because it is AI, we shouldn't be leaving auditing of these models, and then making sure of what goes into these models, right? So we won't go into all the details. I will at the end I'll leave with some papers that we published on going into the details of that, to be a specific 100-page document that we produced around all the components. So there are 12 different components in AI system. Think of those 12 components as pieces of puzzle that are out there as you put together AI system, and as you bring in vendors, are they bringing capabilities for catalog? Are they bringing infrastructure for serving your AI? Are they bringing models? What kind of risks are there? So that's our next thing to discuss. So now that we know there are 12 components in AI system, what we did was we bring in,
Before we get into this next section, You've made this great point about thinking about these AI subsystems, then implementing governance across them. Speaking of that, we know that security frameworks help to inform a structured approach to risk management. How can healthcare organizations leverage frameworks to improve cybersecurity and manage other AI specific risks like data manipulation, consumer privacy, and other ethical implications like bias?
That's a great question, Max. So what happens is now that you have these different pieces that go into a system, you in a given organization, somebody is responsible in that organization, or some vendor is responsible for these components. So first step is to identify who is responsible for each one of those pieces, right? Usually, BizOps are like, in government organizations, it can be, some kind of, application owner would be responsible for coming up with like, requirements and what should go into, an AI system. And then, but there are like, people like governance officers who are looking at this catalog, data operations people who are looking at all the left side components inside of AI system, and then model operations, which can be like, a third party models that may be being put in place, or some contracting agency that is building these models for you. Those are the model operations. And you have these DevSec operations, which is basically can be in-house systems that are going to be there, people that are responsible. So once you have that, now we spent a lot of time looking into which one of these, which at each one of these components, what are the risks? So we need to start thinking about, can we think about what can go wrong in each one of these systems, right? So what we did was we looked at some of the standards that are out there, to look at what risks can happen there. It's like MITRE Atlas is a great example, NIST RMF, and we looked at ISO documentation around AI risks and security. And High Trust is another one that we worked with, where they talk about risks inside of AI components, and we catalog them. So at each one of those, so here is the component number. There are 10 risks that we identified for at that level. Like, data poisoning is an example of that. Not having basically a process to identify and have checks on the data that is coming into your AI system can create issues on the right side. So for example, if somebody poisons the data in a fraud detection system that changes the label, or like that changes the parameter for fraud detection, like, the codes, for example, are changed, then this AI system will go and start either predicting almost all claims as fraudulent or none of them as fraudulent, because a data here in the downstream is manipulated to change the codes or the labels of the data that goes into the training of your AI system, right? So at each one of these, we documented. So here is the full list of catalog of those at each component. The blue color numbers are which component, and then the list is basically what risks may transpire at a given AI component, right? So as I mentioned, there can be a data poisoning risk that can happen, which we are going to use as an example. But there are 62 risks that are cataloged, and the ones in dark color, the black color, are the traditional risks that you should be dealing or should be knowing already if you have any type of software system out there, especially a business intelligence system. And the red ones are novel ones, right? These are like, specific to AI. So we in the paper that we published, we catalog those in a way that anybody can use these at each component and look at those risks and see, does it apply for me, right?
Varun,
Yeah.
I'd like to hear your thoughts on where you think the healthcare industry is with adopting these newer AI controls. How are healthcare organizations evolving to incorporate these controls that consider ethical, safety, and regulatory aspects of AI?
That's a great question. Healthcare is always been very concerned and risk averse, right? Because of the nature of the business, there is, at the at the left side of this, like, basically patient data protection is the kind of most important thing. And when we bring AI, of course, on the right side of the AI predictions, your safety of the health of the patient or the person or the human being is super important. So healthcare is in a very is one of the industries, along with fintech, maybe, I think they're in kind of on par with each other, where, like, they're implementing these guardrails or the security controls in place. We have a customer that we work with called Insulate. They provide basically a pod for insulin. They have a lot of automation in those pods, and they deploy these with lots of care. They look into how to protect the patient data and how to basically overall, like, make sure the systems are operating, and then delivering that precision health in a way that is safe for the patients who are using, right? So definitely there is a good place. The problem, I would say, where they are kind of aspiring to is the adoption of overall, like, putting AI systems because of the risk aversion, right? So there are a lot of companies saying no to some of these systems because they're concerned, or they don't know how to put these mitigation controls, or they don't have full depth of understanding of the risks. So the easiest thing for health systems, especially the security teams in there, or the governance teams, policy teams, is that saying no, right? That's the quickest answer they can give, unfortunately. But that may be impacting modernizing their own systems. And if you're in the commercial side, in the industry, you are not staying competitive. If you are in the public sector, you are basically falling behind on taking advantage of automation of this system, right? So given that these controls are 62 risks are there, the next question is going to be, that is overwhelming. And this goes back with your question. Like, if I want to deploy all the 62, that's a lot. The answer lies in how you're deploying AI. Are you using models that you build on the which is predictive AI that you built on your own, or are you using something like ChatGPT, external models, or are you integrating, fine-tuning a model that you got from the shelf, off the shelf? Are you pre-training your models? Are you prompt engineering into those models, or are you bringing the content, like these medical records, and then sending them to external systems? If you're sending these medical records, like PDF files of health data, do you have enough policies in place with those providers, like Azure OpenAI, in place that govern and protect the safety and security of these documents that you're providing as part of the process, right? So based on how we are using AI in the document that we published, the white paper, we catalog them. If you're using AI in this way, out of those 62, only some apply to you. If you are using AI in pre-training, some other risk set applies to you. So we narrow down and we color code, or we label them, which type of risks apply to how you're using, based on how you're using AI, right? So armed with that knowledge, and we are building slowly, right? How to make this whole overall managing of AI risks easy is building on one by one. First you need to understand the big picture of AI. Second, you need to understand who plays role in which component of AI out of those 12 components. Then what risks are there in each one of those components, and how are you using AI? What kind of models are you deploying? And then now you need to map that into the risk set that applies to your deployment model. And then on that big picture, you can place those risks, right? We talked about where does data poisoning appear. So we catalog that. So data poisoning can appear in, somebody can poison the data at the source, the raw data. This is kind of very well known, a risk to AI systems, where the data itself is poisoned. If the labeling of which one of the claims is fraudulent is flipped or changed, everything else is going to go wrong, right? Like, or like data poisoning can happen at the training data set level, like, by manipulating the training data itself, and or the feedback that goes into this AI system. If someone keeps on saying something that is like a human in the loop, like, for example, think of this as an example where you're driving from point A to point B, and then AI model asks you, is there a stalled vehicle on the right side? If 10 people say no, 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 even though there is a stalled vehicle, now the next time it says there is no stalled vehicle, because AI doesn't see. It is basically depending upon people giving it feedback. So if that loop itself is manipulated, AI thinks, okay, this claim that we are talking about, 10 times I got, like, I thought this claim is fraudulent, but human in the loop is giving me intentionally poisoning me and giving me incorrect loop back. And then that can also affect my outcomes. From here on, I'm going to say, even though I think this model is fraudulent based on my historical understanding of it, I'm getting this feedback that this is not fraudulent. So I'm going to honor that, which is good if it is proper input, but data poisoning can happen. So the question here is that who has the ability to give that feedback in a given organization? Who has permissions to get the data? Who has permission to access the data, right? Those are the things that we need to think about. Once you place out, that was just one out of 62 we talked about. Now you will be able to contextualize based on the deployment model, and then you're going to apply the control set that is out there. What we did is, one of the important aspects here is that we not only documented 62 risks, but we also documented the controls that goes with each one of those risks. That we, for given this risk, here are the 2 controls or 10 controls that you need to have in place. And a lot of things that are in the dark color should not be in use for a lot of practitioners, right? Those are traditional cybersecurity controls that everybody should be familiar with and must be practicing, like single sign-on, MFA, and having boundary around your AI system, network controls that somebody from Starbucks should not be able to, sitting there on a laptop, should not be accessing this healthcare application. They need to be coming from a known laptop. Can be a simple control, right? So that they don't manipulate. If they do, audit controls around that. The ones in blue are the novel controls that we proposed as part of that practice that you should be deploying them, right? So now that you armed with those controls for a given data poisoning, here are all the generic controls that we talk about. Like, do you have, quality? Do you have access policies? Who can bring them? Do you have single sign-on? Who can actually, get this data into the system? Do you have no network boundary? And are you versioning your data if something to go wrong? Do you have detection mechanisms to detect if there is a poisoning happening to your data, right? And if it happened to be on Databricks, we give specific controls, how to implement them, but that's not the important part for this discussion. For any vendor or anybody, any system that you're bringing, you are going to now, armed with this, you're going to ask these questions to your AI providers or like a platform or software providers to your organization that, hey, I understand that these are the components. I understand that these are the risks involved. I want to know if we have these controls in place before we can productionize these applications. And more importantly, I want to productionize those by implementing these controls very quickly so that I can take advantage of AI, right? And we leave people with documentation to our product, but that's not the important part here. And we cataloged in the white paper that I'm about to go into in a bit, top controls that you should be having, and then how they basically transpire into different risks, how they mitigate those risks. So overall, this session might have felt a little bit overwhelming because we went really fast through some important and very new concepts. So if you are going to walk away from here with this session with one thing, I would say this is the slide that you should be paying attention to. So in Databricks AI Security Framework, which is generic framework for any AI system out there, not necessarily for Databricks only, right? First, start with a use case and make sure you have the data set that is needed to deploy and take advantage of that use case. We talked about, as an example, a fraud detection system for in health claims, right? So do you have past health claims with fraud and non-fraud labels? Or do you have the necessary codes that are used in claim processing, right? And do you have the use case that is basically the fraud detection system, right? So once you have that, and once you have the stakeholders, then what kind of AI are you going to use? Are you going to use something like ChatGPT, or are you going to build your own ML model, traditional ML model? Are you going to take an off-the-shelf model from Hugging Face and train that to build your model, right? So decide which deployment of AI, which type of AI are you going to use, right? So with these two things, now in Databricks AI Security Framework, you can narrow down from 62 risks that we listed to subset of that 62 risks, because certain risks do not apply based on which deployment model that you're doing with AI. For example, if you're using ChatGPT, safety and security of that specific model being stolen from OpenAI is not your concern. That is OpenAI's concern. So you don't need to worry about what if somebody is stealing my AI model, right? Because that's hosted by ChatGPT or OpenAI, and they should be concerned. For you, what is important in this case? How are those access credentials that are needed to talk to OpenAI? Who in my organization has those, right? Are they? What happens to my data when I send it to Azure OpenAI? Is that safely kept? Is that encrypted in transit? And who has access to send this data to build this use case? Those are the types of questions. That's why it's narrow set, right? If you're building your own model off of your data, safety of protecting that model, because it is built on your patient data, is important to you, right? You need to make sure that a model is stored safely, encrypted, and all of that. So you take that narrow set of risks. Now, remember, we don't leave you just with the risks. We also have the controls that are prescribed by MITRE or like prescribed by 10 other standards that we looked at. Make sure you have narrow set of controls that is applicable to you, and then deploy them by following the vendor documentation. Ask the vendor, hey, I have these controls that I need to deploy when I'm building this AI system on my patient data or my health, for my health application, and show me the documentation, or show me this is by default switched on, or show me how I can prove that I have this in place, right? So you ask those questions. So if you're walking away after looking at that model, and if you want to get deeper details of that, as I mentioned, entire framework is for any vendor or any type of application that you're building for AI system. It's not just for Databricks. You can download this paper, which goes in depth in a 100-page document that we built by partnering with subject matter experts in security, policy, and as well as in building these AI systems like data scientists, and then they all contributed, and you can take advantage of that. It comes with worksheets that you can use and operationalize, and filter on what risks that apply, so that you can basically implement these AI security controls in Databricks AI Security Framework 2.0. We delivered this with these mappings. We not only provide you the risk set, we map them to WASP top, LLM top 10, ML top 10, high trust, MITRE. So if you're looking at the risks from that perspective, you can easily kind of see explanation of how to accomplish those controls for those risks. And then we leave you with the necessary compendium worksheet that you can use and operational in your organization. And you can ask these questions if you're buying from somebody some kind of any component of these or combination of these things. You can ask the vendor, hey, have you thought about these risks? How do you reason about the controls? How can I deploy these controls so that my patient data is used for improving their outcomes, in a way that I can take advantage of AI while minimizing the risks that may come with AI.
Arun,
So with that, back to you, Mac.
thinking about AI security frameworks, as AI security frameworks develop and mature, what can healthcare organizations do to better prepare and ensure an adaptive security approach for managing AI risk?
Yeah, so my recommendation is basically start with a use case, and then identify the deployment model that you would be using the AI, and then take advantage of the worksheets, the compendium worksheet that I mentioned earlier. You can get to that from this QR code that is in the bottom right corner, and then you can download the PDF file, you can download the compendium worksheets, and then you can put this framework in place by following step by step. There are video instructions on how to use the worksheet, and then ultimately ask the questions. We started off earlier with these the risk, the limitations that we talked about. Armed with these overall instructions, like you have all the answers that are necessary to get started with, and then iteratively get into the details of the the process that involved, and then making sure that the risks are well understood. And then once you get the full understanding of the risk, the controls that you need are deployed in your platform, and making sure that you are practicing AI with cautious mind, at the same time not saying no, but embracing AI in a way that it is going to help with the outcomes.
Thank you, Arun. You've highlighted the importance of oversight across the AI components and subsystems. Given that AI oversight is a shared responsibility, what governance structure should be in place to incorporate and operationalize AI security frameworks?
Yeah, so we talked about this in a bit earlier. First, the most important piece here is that understanding of the components, right? Like, overall, who owns in a given AI system or the application, who owns which component? That's number one thing. And the next part is personas. Like, we talked about people. So within a given organization, identifying and making sure that the responsibilities in the shared responsibility model are set on the right teams, and in the overall in a grand scheme of application development, you may have vendors involved, you may have IT teams, and all of that comes with any project that you have done in the past. Apply those learnings, apply those processes that you have, but make sure that in the context of AI, you have the right people to operationalize this, right? So with that in place, making sure that those people understand the risks in that component that we talked about, and making sure that they understand the controls, and then checking those controls are deployed using the worksheet that I talked about that comes with the paper. And ultimately, in the worksheet, you can, when we talk about AI risk worksheet, the compendium that I talked about, you can assign people names, like, this control shall be implemented by, IT, and this control should be implemented by vendor or whatnot, right? Recognizing those things, and then making sure that those are deployed.
Thank you, Arun.
Yeah.
So, Arun, thank you so much for a great presentation. And thanks again for participating in the Maryland Healthcare Commission's Healthcare AI Symposium series. That concludes the presentation. To view more presentations, please visit the AI Symposium webpage on the Maryland Healthcare Commission's website.